Since January, Hamilton paramedics reported to 724 suspected opioid overdoses, a huge jump from the 565 calls in 2020 and the 596 in 2019. The majority of those overdoses occur in Ward 2 and 3. Currently, there's only one supervised injection site here in Hamilton at the Urban Core Health Center right downtown, but there could be a second one popping up in the next couple of months, Martin Street East. But there's still a lot of red tape to cut through before the space is ready.
So we have to get municipal support, and then we have to do a community engagement process, which we're doing right now, just coming towards the end of that. So those are the two outstanding pieces. It'll be up to the Ministry of Health then to decide to ultimately finally approve it.
While there are a lot of factors that play into the sharp increase, the pandemic has made it worse.
We've seen a 50% increase between 2019 and 2020, and we're expecting to see that double again this year.
When COVID-19 struck in 2020, Hamilton's opioid-related death rate was nearly 30% higher than the provincial average. Addiction specialists say COVID caused supports to dwindle, putting sick people in dangerous positions.
The places that people often went to for support were closed, like the Tim Hortons, the coffee shops, some of the drop-ins. Some of the services moved to virtual services instead of in person.
Throughout the pandemic that we have seen an alarming amount of overdoses or drug poisonings.
The problem continues to be province-wide.
Over the past 18 days, our officers have attended 23 drug poisonings throughout Halton. And obviously, while any overdoses are a cause for concern, that number was particularly concerning to our service.
Out of those 23 overdoses, 2 of those people died. While the ball is moving on the second injection site in Hamilton, addiction resources are doing what they can in the meantime.
Specialized harm reduction plans with folks that are identified as high risk. So people that are overdosing frequently, people that are at high risk for overdose, people whose health is negatively impacted. So basically just sitting down, having those conversations with folks and bringing them to primary health care, bringing them to detox beds, referring them to wherever they need.
Mission Services Hamilton also points out many unhoused people during the pandemic have been put up in hotels, which, compared to shelters, are not open concept. Thus, staff have zero eyes on people, leaving a lot of room for overdoses without anyone noticing.